I started having depression between 11 and 12 years old. The reason we kind of know it started that early is the first suicide attempt was at 12. Then once I was in college, kind of sought some help out myself and found out that I did suffer from depression and anxiety. The big thing was no one knew. My family didn't know I was suffering and kept straight A student, valedictorian, was in multiple different academic programs.
She's a little atypical because she is exceptionally functional. So her depression has been profound and difficult, and yet she has often pushed through. For example, she has continued to work the entire time that she has been receiving treatment through our clinic.
There's a small subset of people who have treatment-resistant depression that they do better when they continue daily life. So I didn't have the symptoms like I can't get out of bed in the morning, that I'm not eating, I'm not sleeping, or I'm sleeping way too much, things like that. But it wasn't helping. I was in and out of higher levels of care, whether that was day treatment programs or inpatient.
The pain of the severe depression is quite unimaginable to those who have not suffered it.
So I continued my research and I found that this clinic existed, and that's how I met Dr. Albott.
We typically see people with very, very, very difficult to treat depression who have often had very difficult life experiences that have sort of brought them to this place.
I see Dr. Albott on a weekly basis for several years now, and it's literally been life-changing.
Becky gets most of the treatments that we offer in our clinic. She gets probably one of the newest forms of treatment, which is intravenous ketamine for the treatment of depression.
And they also offered something called TMS, transcranial magnetic stimulation, that I had never tried or heard of before.
And that's a form of brain stimulation that sort of treats the place that we think is dysfunctional. I think it's a very exciting treatment because you come in for those 8 weeks, and then you're done. So the idea of sort of having to be on an oral medication that causes you all of these different side effects isn't something that's required with TMS. So after you're done, people typically do well for potentially indefinitely.
Those good days are when you're like, I'm really mad about this, or I'm really hurt by what somebody said. And it's not sticky. You don't hold on to it. Everything kind of is just like edges are rounded is the best way I can kind of put it, and things just flow.
I think brain stimulation is really, at the end of the day, probably the future of psychiatry. So I'm not surprised that she's doing well. She's kind of a superstar, and our treatments are helpful.
Being at this clinic has meant a lot to me. From the beginning, I felt welcomed, and I felt a part of my treatment team. I have a really good relationship with Dr. Albott. I feel like no decisions are made about me, they're made with me. I feel that she really cares.
My clinical approach to people is that my patients really are the experts in their experience. I haven't lived what they have lived, and so I really see our clinical relationship as being a partnership.
We see it with the intensity and gravity and weight that it is on an individual level and on a societal level.
I will also say that the group I work in is exceptional. All of the clinicians that are in our group are also researchers that are seeing patients, hearing what the problems are, appreciating what that looks like phenomenologically and in the clinic. It's hard to be a psychiatrist when you face a lot of these disorders that are difficult to treat, but that's, I think, what makes me in some ways so lucky. I get to treat patients and I get to develop the treatments that are going to give them hope.
I think it's very important for people to know that when you can't hold that hope for yourself, that there's people out there who want to help you by holding the hope for you.